Hi, I'm Dr. Ganesh Nagarajan. I am the Director of GI and Liver and Pancreatic Cancers in Nanavati Max Institute of Cancer Care. I'd like to share with you certain, facts about colorectal cancers. Today, over the last decade, we have noticed a very disturbing trend. We found that almost 1 in 4 or 1 in 5 patients who come to our clinic with colorectal cancers are below the age of 40. Previously, maybe 20 years back, we would see the occasional patient who would be young. Today, it's become fairly common. And this trend is only increasing. This was common in the West. Today, it's fairly common in urban India as well. It's probably got to do a lot with our changing lifestyles. It's a lot to do with the kind of food we eat, the kind of processed foods that we are consuming in urban India. The traditional Indian diet has probably been replaced to a large extent, especially in the younger Indian population, by a highly westernized diet. And that, I think, has contributed tremendously to the surge in colorectal cancers in younger patients. The traditional Indian diet was full of fiber, was full of fresh food, which is today, fiber is very less, it's highly processed, a lot of junk food, a lot of fast food, coupled with a lot of processed foods and combined with the fact that we have a lot of pesticides in the food as well. And all of these together have contributed to this increase in the younger population. It is important to understand that just because one is young, one should not ignore certain signs and symptoms. Often patients think that because they've been having some blood and stool, but they feel they are young, they've ignored it for quite a few months before they actually land up with a doctor and get investigated and then find out that they have cancer. And unfortunately, over this period, this cancer is spread, it's increased, and it becomes tougher to treat, and the long-term prognosis also gets affected. So I think it's very important to have an awareness that these cancers are not just something that is going to affect the elderly, but it could also affect the younger population. And I think it's important that one doesn't ignore signs and symptoms, which could be as simple or innocuous as bleeding in stool. It could be just a change in bowel habits, chronic alternating constipation or diarrhea, or a weight loss which is not really explainable. I think these are all red flags that one should look out for. Meet a doctor, get investigated, get a colonoscopy, and usually these are cancers if picked up early, are completely treatable, and there are so many modalities of treatment today, and a lot of these patients do very well, get back to normal life and have absolutely healthy lives, and have a very long life after that. So nothing to be scared of, but it's important that there's enough awareness about these facts. Thank you.